In this presentation, I'm going to discuss the basics about BiPAP and the ventilator. So this presentation is just an introduction to BiPAP and the ventilator. So I'm going to discuss about various common terminologies which are being used when you talk about ventilators. But the detailed discussion about the ventilators will be covered in practical sessions. So when we talk about ventilators, we use terms like pressure support, positive and expiratory pressure, or the PEEP and the FI2. Now, what do you mean by pressure support? Pressure support is that inspiratory pressure that is generated by BiPAP or the ventilator machine to, support the spontaneous breath of the patient. So either it is partially supported or fully supported. Now, positive and expiratory pressure or the PEEP is that pressure that keeps the alveoli open at the end of expiration. So what does this pressure support and positive and expiratory pressure, the PEEP does? Pressure support improves the ventilation, that is the CO2 part, and the PEEP improves the oxygenation, that is O2 part. Now FI2 is fractional inspired concentration of oxygen. So it varies from 21% at the atmosphere concentration to 100%. Now there are various modes to ventilate the patient with the help of ventilators, but these two kind of modes are frequently used. One is synchronized intermittent mandatory ventilation. Another is controlled mandatory ventilation. In synchronized ventilator mode ventilation, the ventilator delivers the set tidal volume and the respiratory rate to the patient. But the patient is able to take his or her respiration spontaneously. And this spontaneously breaths are being supported by the ventilator. So this mode is known as synchronized intermittent mandatory ventilation. Another mode of ventilation is controlled mandatory ventilation. Now, in this, the ventilator delivers the set tidal volume or the pressure at a set respiratory rate, but it does not allow the spontaneous breaths which are being taken by the patient. So it does not support the spontaneous breaths which are generated by the patient. So this is the common difference between two modes, and the most commonly mode during ventilation in the ICU patient is synchronized intermittent mandatory ventilation. Thank you.